This is Craig Redden. I'll be discussing medical ethics in anthropology. This is the final project for visual anthropology in fall 2021. The concept of informed consent ties heavily with the concept of bodily autonomy, the idea that the patient has ultimate power over what happens to them based on their own beliefs and moral compass. They're in charge. The physician is the expert, the educator, and the facilitator. The same guidelines apply in anthropology as well. Informed consent relies on all participants being informed of all the parts of the study, what info you will be recording, how you will use it, and what your purpose for recording this is, the end goal of your research. The relationship between a researcher and his subjects is not too different from the doctor-patient relationship. In order to effectively practice medicine, a physician does not need to dictate his preferred course of action, but rather to provide options and go through with whatever options the patient chooses. And this may very well include choosing not to treat. Similar guidelines are part of good anthropological practice. As a researcher, it's our job to impartially record what we witness, but our very presence there makes the act itself not at all impartial. Since the camera, the notepad, and the researcher will always alter behavior somehow, it's necessary to address your own presence to reduce potential bias. And besides informing the subjects of what's going on, what you're going to be doing, and how you're going to be using the information, you also need to know them. Trust and communication are essential in medical relationships and in anthropological relationships. Lives can either be improved by doing this right or harmed by doing it wrong. And if you know your participants, you don't have to like them, but you do have to care. Trust is key, and if you get that relationship right, you will be benefiting everyone. You won't just be dragging yourself out to the middle of nowhere and getting all your data and then hightailing it back to where you have hot water and cold beer. The two men pictured in this slide are both physicians who worked in Africa in the late 19th century, and they are both excellent cases of physicians and anthropologists doing things the right way. The man on the top is Albert Schweitzer. He was a German physician who went to Africa to help improve sanitation in hospitals, ended up having quite a few hospitals named after him, and he spent the rest of his life in Africa and died in Gabon, and you can see him there with babies that I believe he helped to deliver. The man on the bottom is David Livingstone. He was a Scottish preacher and physician, and one of my favorite people in history, so he gets the cool picture. He also went to Africa to help treat and minister, opened many hospitals and clinics, and generally provided care to the people. And this picture is a completely accurate portrayal of one of the many lion death matches that he got into doing what he had to do. This is the cost of caring. This is a case where a medical researcher saved hundreds, if not thousands of lives, maybe tens of thousands, by being not only a diligent scientist, but a fine anthropologist. In 1961, a prion disease called Kuru was ravaging the Foray people in the highlands of Papua New Guinea. The disease did not spread by any model that made sense. A random person, male or female, could have muscle weakness and fever one week, uncontrollable muscle movement the second week, and the third week they would either be comatose or dead. This progression could take days or it could take months, but once the first symptoms appeared, death was guaranteed, and it was probably coming fast. Now, of course, this was bad enough, but anywhere between a few weeks to several years later, the same thing would happen to another member of the same family. This time, however, it would be an immediate female relation or a male who was young, normally under about age 8, when the relative died. It was clear that Kuru was some sort of neurological disorder, and there were similar diseases that occasionally popped up around the world, but that was all anybody knew, and the other ones were typically limited to animal populations. There were very few cases where humans were getting diseases like this. So Australian medical researcher Michael Alpers, that's the man in the top right, was one of very few people attempting to figure out exactly how this disease was spreading. He was creative in his approach, likely because nothing else had worked. Instead of taking extensive notes on the patients only while they were alive, he also continued to observe what happened after the patient died, and that turned out to be the key. But even a large funeral is still an intimate affair, and a stranger, much less a white stranger who's always asking you strange questions, would not be welcome. So Alpers decided that he would stop being a stranger. He took the time to communicate effectively with the people that he was here to try and stop this disease, whatever it was, and he earned their trust by living with the Foray full-time. He ate with them, showed them his photographs and notes, and convinced the people that unlike many of the authorities on New Guinea, he was not there to destroy their lifestyle and try to integrate them into Western culture. As he had proven himself to be trustworthy and that he was trying to help, he was invited to the funeral of a man who had died of Kuru. Now, he already knew that the Foray were rumored to be cannibals, however, he had no real specifics, and he hadn't pushed for information on the subject. The practice had already been outlawed by the white government authorities, but it was about as effective as if our government had outlawed burying our dead. The only thing that would change is that we would have burials when they weren't watching. And the same thing was going on in New Guinea. And that's, of course, a major part of the reluctance to let Alpers watch. But he was allowed, and he observed right away that part of the funeral ritual is the preparation, cooking, and consumption of the body of the deceased. Alpers figured that this was the critical factor, because not only were the Foray practicing mortuary cannibalism, but the women and young children were the ones who handled and consumed the brain of the deceased. So, he had found his transmission method, but now his team needed tissue samples. Just like rabies, the only definitive diagnosis for Kuru requires microscope analysis of brain tissue. And so, now not only did he have to be allowed to witness a funeral, he now had to take brain tissue himself. And it had to be quick. It had to be right after the person died, because any decay can completely destroy our evidence. Around this time, there was an 11-year-old girl called Kigea. She had Kuru, and it was advancing rapidly. Alpers knew the girl and her family, and he approached them and explained what he needed, why he needed it, and what would be done with the samples. And so, amazingly, and due only to his willingness to integrate and understand, he was given permission by the girl's father to take brain tissue of his daughter immediately after she died. And unfortunately, he didn't have to wait very long. She was the next Kuru death in the population that he was studying. Kuru was well on its way to wipe out the Foray people completely. Nearly 10% of the population at any one time had the disease, and it's 100% fatal. And after every fatality, more and more people became sick, and the cycle just continued again. There is some natural immunity that exists within the population, but it is only about 5% that seems to be immune, and the only way that we know that is because there were people who were recorded and have said that they did eat the brain tissue multiple times and never got sick. And so that could just be luck. There may not be any immunity at all. That's just what it looks like. So, although the legislation to outlaw cannibalism was not introduced for any epidemiological reason, it was mostly for moral outrage on the part of the government, it was still ineffective. The only way to stop the practice, which Alpers was eventually able to do, was to identify what was going on and then actually educate the Foray people. They needed to understand the disease, and they needed to understand that it was clear to them, but this is going to kill you off. And it was successful, and the last recorded Kuru death occurred in 2009. Since then, there have been no new cases, and that effort is due entirely to Michael Alpers doing not only his job properly, but being an anthropologist, completely untrained, properly too. Alright, now I'm going to discuss the book, Lissa. Although the entire book discusses bodily autonomy, I'll be discussing part 3 since it highlights the problems of failure in communication and the benefits of good communication. The stress between Anna and Layla could have been reduced if they each understood more of the other's culture and personal beliefs. Layla and her family rely on God and the Quran for peace, and the light of treatment being so unaffordable that it's functionally unobtainable to them in the first place. This picture on the left is from page 46, when Baba Hassan and his wife discuss Anna's mother's death, and they're disturbed by her wishes to be cremated and spread in the ocean, as was done with her sister as well. This is contrary to traditional Islamic burial practices, where the body is typically not even embalmed. You're buried very quickly in Islam. But Baba Hassan tells his wife that it's not our place to judge what they do, we can only pray for her soul. And that is an attitude that needs to be brought into anthropological work too. We are not here to judge, we're here to help. Failures like this continue from the other perspective as well. Although Anna doesn't understand the decision of her mother to reject medical treatment, she overhears that the reason that she opted to withhold that treatment was because her own sister had similar treatments done, and they did nothing except make her sick and miserable until she died at about the same time that the cancer would have killed her on its own. And so although the families are friends and they understand each other outwardly, and they certainly know and love each other, the cultural divide widens whenever difficult circumstances, like the Arab Spring, call the girls to have to reconcile directly. When Layla discovers that Anna had a preventative mastectomy and confronts her directly, she's disgusted and believes that Anna has mutilated her healthy body. Anna is similarly shocked that Layla's father does not even consider trying to find a kidney donor, which could have allowed him to continue working to provide for his family. Even though they've rebuilt their relationship at the end of the story, the strain could have been avoided if both parties had been willing to put aside their beliefs, no matter how deeply held they might be, in order to support, comfort, and help the other. An ancillary concept that presents itself throughout the story in Lissa is the utility of one's own life. Only the individual is in charge of determining what their life is worth. Lissa does not explicitly discuss the idea, but it's heavily implied by the inclusion of self-immolation cases that the author clearly intends to draw a parallel between burning yourself alive to fulfill your purpose and refusing or undergoing certain medical treatments for the same reasons. It's not up to anybody else to decide what their life is about and what their life is for. If you believe that you're here to do something that the creator of the universe wants you to do, then the extension of life is not the most important consideration. You're here to get your job done. Those same beliefs, however, might lead someone to pursue aggressive treatment, even with poor side effects and discomfort, if the chance of survival and continuing to work is a reasonable chance for them. In dead birds, it may seem just completely bizarre that tribal warfare occurs, even though the people fighting have at least some awareness of the outside world, and that things are not like this everywhere. And yet they still choose to fight over a relatively small amount of resources and land. They're fighting for what's important to them. Death in combat, even over a small amount of resources in this case, will go towards keeping your family alive and providing for the family group. You're not the one dying to feed your family, and your judgment can do nothing except undermine your own anthropological integrity. Ethics needs to be the first consideration to any anthropology or ethnography project. No matter what the subject or purpose of your study is, the researchers need to be prepared to have their work cited and discussed in the future. Proper relationships and ethical considerations are the deciding factor whether your work is taught as excellent field methods or a case study in what not to do. Because after your work is published, you can only give extra commentary. You have very little control over the interpretation and legacy. And you do not just need to look at ethics one time. You need to be constantly looking through and thinking about what is right and wrong. It's normally a gut feeling. Not always. You have to consider 2 or 3 steps down the line, what is this decision going to do, and what do I need to do better to prevent poor outcomes. Here are the references that I used. Thank you very much.